Hello. This is Irina Strunina and our podcast, Diabetically Speaking with Smart Move 360, where we meet every Thursday. And I'm inviting as my guests people who are working in health and wellness, people who are healthcare professionals, life coaches, maybe nurses, maybe dietitians, and they are sharing with us their expertise, their knowledge, their wisdom, so we can stay empowered and be informed and educated while living lives with diabetes or trying to prevent that. Um, on every last Thursday of the month, I'm inviting a person who has this diagnosis, and this special podcast called Warriors Edition. So you can hear the stories from people who already had some experiences, successes, aha moments, and downfalls, and how did they recover from that. So share this information with anyone who you think can benefit from learning and listening and maybe get inspired, because everyone who I am inviting here has a very important message to share. And today I have a very interesting guest. We met with him on a business event, and now I learned so much about him. So I invited him to be my guest because his story is amazing. And his name is Peter Wainberg, and he is life and heart health coach. So I know that when I was receiving my nutritionist certification, I was learning the diabetes and cardiovascular diseases nutrition for those two diagnoses. So it's very related, and I thought that his story will be very important to hear. So, Peter, welcome to the podcast, and please tell us about yourself and your story.
Well, thank you so much. I'm honored to be here today. Well, look, my journey began in 2010, 15 years ago, when my father's brother, my uncle, just collapsed at the Houston airport. He had a heart attack and a stroke, and I really had no idea what was going on. I was confused because he was always talking about his health, keeping his weight down. And 2016, September 2016. My first cousin collapsed with an aortic dissection at work, and he was leaking blood. There's a 10% survival rate. By the way, my uncle ended up in a wheelchair. My cousin ended up in a wheelchair. And then um, uh, the following month, October 2016, I had some pressure on my chest. My father took me to the Montreal Heart Institute, and doctors told me, to my complete shock, as a 57-year-old non-smoking, non-drinking, very fit, multi-sport, high-level athlete, that I was at the edge of death and had absolutely no idea. I had severe aortic valve stenosis. My aortic valve, my heart pumps blood. My aortic valve wasn't opening or closing. It was calcified. And I was literally in a state of shock. And luckily, I survived. I'm the only, member of my family to have survived heart disease and have my freedom to be able to share my story with you. And so I went on this journey, and I've discovered a lot of the secrets about heart health, heart disease, secrets about myself, and secrets that are really not taught out there. And so my real journey began 3 months after my open heart surgery. Rehab began with a blood test, and I got reminded of how high my cholesterol was. And I went on a journey for 2 years, meeting with a dozen doctors, dietitians, and nutritionists, begging them and pleading with them, please help me to lower my cholesterol. You see, I had this open heart surgery, this aortic valve stenosis. I don't want to have heart disease. I want to have live my healthiest and happiest life. And nobody could help me. And as I got invited to go on live TV just 1 week before COVID, March of 2020, I was doing some research, and I built this great website. And I found Dr. Caldwell Esselstyn, and he was talking about the health benefits of a plant-based diet. And wouldn't you know it, I went on a plant-based diet for several years, but little did I know, I was able to normalize my cholesterol, but then I didn't realize I wasn't paying attention to my A1C, my
Yeah.
glucose. And on a plant-based diet, my A1C was going up. And in fact, my A1C at one point was so bad, I was actually in the diabetic range. I never thought I would even have diabetes. And it was November of 2023. Um, I had a floater in my eye,
Yeah.
and I started to do some research on it, and I realized that, wow, I have diabetic retinopathy. And I went back and I checked all my blood test results, and I said, I think I have diabetes or a pre-diabetes. And
Yeah.
what should I do about this? And so I went on this journey of of reversing my type 2 diabetes. I
Yeah.
went on a journey of learning about it, and it's really been an extraordinary journey. And just wanted to share that as kind of the summary of my story. And now I'm totally aware of not just being on a plant-based diet for reducing plaque and inflammation in my body, but I'm also really paying attention to the inflammatory foods
Yes.
that will spike my glucose. And probably the greatest transformational experience I ever had in my life was putting on a CGM, a continuous
Yeah.
glucose monitor on my arm. And I remember the first day I had this big red Honeycrisp apple, and you're sitting there eating and you're watching on your phone, your glucose spiking, and I'm just watching my glucose go from 7 to 10.5 with a red apple. And I asked my mentor, what's going on? And she said, Peter, like, didn't you read the course material? It says, like, no red apples, green apples only, and the small ones. And so, I didn't realize, we would normally think just having a high sugar diet. By the way, I was on a plant-based SOS-free, salt, oil, sugar-free diet. And even on a plant-based, salt, oil, sugar-free, my glucose was going up and up, and I really had no idea. And I paid the price by not paying attention. I still have this floater in my right eye, and I'm still looking for ways to reverse it. I have the belief and the confidence that I will figure it out. And I've even narrowed down my diet even stricter. And I've really discovered there are so many foods that are inflammatory. With a continuous glucose meter, I was on this program at the Institute of Nutrition and Endocrinology called the Sweet Spot Solution. So you wear the CGM for 2 weeks. 1 week, you're on your regular diet,
Yes.
and you see what is inflammatory for you. And the second week, you actually start modifying your diet. And probably one of the greatest secrets that I've learned was that we have our own genetics. I
Yeah.
mean, and um, you could eat 3 bananas and be fine. I could have one bite of a banana and I could spike my glucose, right? So
Absolutely.
it's not what your doctor tells you. It's not about the northern diet, the western diet, the eastern diet, the southern diet. It's the diet that fits your genetics. I think that's a huge secret that I've learned. And as I went through all of the foods that I was eating, literally every single cereal was spiking my glucose.
Of course.
The breads that I was eating, the pastas, um, and the list goes on and on. And so I actually ended up doing like a diabetic reset
Hmm.
or a 30-day program. And that was the most transformational time of my life. It's almost a year ago. It was March of 2024. And I think that was the most eye-opening experience of my life. So I wanted to share that with you. And that's really, my mess has now become my message. Um, and I wanted to share that with your audience.
I appreciate it. This is actually so much discussed in our Facebook group, Diabetes 101 for Beginners,
Right.
because we have a lot of people. We have thousands of people in the Facebook group, and everybody has their own story. Even though some stories look like yours, but yes, maybe it looks like yours, but you definitely have different set of parents, different set of genetics, different maybe even cultures where you were raised in, right? And because of this, your body, even though the story sounds the same, or not the same, similar, your body may react very differently. And this is why we are always saying that your number one job is to learn about the diagnosis and to learn about your personal body, how your body can work with everything around, how it's reacting to all irritants or to all treatments, and just learn, be patient. It's not the sprint, it's a marathon, and the patience and consistency actually the best, I think the best I don't know, qualities, I think, that will help you to actually get to results you looking for.
Right. You know, what we really don't understand about life is we're born with our health freedom, but not our financial freedom. And so the system takes us through school, and inspires us, encourages us to get a job and earn money. And we live our life taking our health for granted.
Yes.
We're born into balance, and if we don't have any problems, if we don't have any symptoms, we're okay. And I say, why should this beautiful thing called life and health be a guess?
Mhm.
Life is all about your health. That's the foundation of your life. And so I had this awakening um, in the past 8 years since I discovered I was born with heart disease that our heart's health is life's highest and most important goal. Optimal heart health is life's highest and most important goal. And I didn't know anything about hearts, and neither did anybody else I know. So I found this to be um, very strange how society and the system doesn't educate us about the most important part of our physical body. It's our heart. And I think that our heart's health is really that path to your freedom. And if you can actually achieve your heart's health, you can really live your healthiest and happiest life. You can live the life of your dreams. And we know that people with type 2 diabetes, two-thirds of them are going to end up with heart disease, right?
Yes.
So um, there's overwhelming evidence. And the beautiful thing that you're doing, I know you shared your husband's story with me, the beautiful work that you're doing in spreading this word, because there's actually a crisis going on, the biggest crisis we've ever faced. We've had a pandemic of COVID in the last many years. There's a massive epidemic that I learned at the Institute of Nutritional Endocrinology. Would you believe in 2019, 89% of the North American population were metabolically unwell,
Yes, I did. I was
overweight,
looking for this
actually
information.
overweight and elevated A1C. So that's men with a waist size over 40, women with a waist size over 35 inches, elevated A1C at 5.7 or higher. But in 2022, we went from 89% to 93%. 93 out of 100 people are metabolically unwell. And if you're metabolically unwell, okay, there are 5 stages between health and diabetes. If you're metabolically unwell, that's the last step before diabetes. And if you're metabolically unwell, I think we need to sound the alarm bell and get people to reverse it. And I think one of the greatest secrets that I've learned along my journey is not only is heart disease is reversible, but also diabetes is reversible. And I'm on a mission to help people to awaken to the importance of this beautiful thing called life, because life is beautiful if yeah, and we can live the life of our dreams as long as we really have our freedom. And so what happened to my uncle, who ended up in a wheelchair for 15 years, his life was on a steady decline. Unfortunately, in December of 2024, he passed away, and my first cousin has been in a wheelchair. I mean, their lives are on a decline. You end up into a life of loneliness, depression, unhappiness, even some suicidal thoughts. And how happy could one be if we just make that choice to say, I want to get on that road to health, right? And so if you don't mind, if I could share a couple slides.
Yes, sure.
Yeah. So let me just so I'm just really on a mission really to help people who are unknowing. We are not educated, in on heart health and diabetes, in prevention. And my whole mission is to help people just to start taking steps towards health. What are the things that I can do to start changing, I know we talked about lifestyle. How can I get into a state of ideal wellness? And I just wanted to share this is really life-changing. So there could be some really bad things that could be happening to people at the Institute of Nutritional Endocrinology. The acronym for bad is blindness, amputation, and dialysis. And would you believe uh, with with a glucose reading of 100, your body starts having difficulty in producing high level, high quality beta cells. At 120, we're looking at diabetic retinopathy, and at 140, we're looking at nerve damage. And so when you see people losing their eyesight, having amputations and dialysis, the red light's got to go on, or even have symptoms towards this that they are, in a diabetic state. And a lot of people don't realize that whether you have symptoms, if you have headache or nausea or fever, you're taking drugs or medications, there's this big disease brewing inside of you. If you have a waist size over 40 for men, over 35 for women, and an A1C over 5.7. And here's a really impacting visual that I really got the message. Listen, your house is on fire, and you have the chance to extinguish it, before save your house before you lose what we want in our life the most, which I discovered is our freedom.
Yes, definitely. Well, absolutely. And I totally agree with you that um, when we are paying attention to what we are doing, when we are kind of consciously making choices, not the most convenient, not the easiest, but given the choice, this is a little bit requires a little bit of more work, preparation, planning, rather than grab something on the go or call the DoorDash and delivery. Uh, it's easy. It's easy, and we later on paying the price with our health, rather than when we go a little bit more challenging, more complicated route, when you have to learn, when you have to make some uncomfortable decisions and follow through, then there is a good chance to actually get yourself out of challenging situation. And the beautiful thing is, and what I love the best, is once you adopt this lifestyle, once you make a choice, I choose this lifestyle. I like it better because it allows me to do much more. And yes, when you're buying a good car and it requires the premium gasoline, if you put in it this just basic, it will not run too fast and it will not run far enough, even though the manufacturer promised you the most comfortable, luxurious, and fast ride. Well, like, it's not doing it well because the fuel is wrong. We do need to pay attention what we are loading our bodies with. If we clean up the windshields, right, to for the comfortable ride, this is also important. I totally agree with you.
I think, where does this journey begin? If we understand how our bodies function, if
Mhm.
we understand what lifestyle changes, we need to make in order to maintain that balance, the homeostasis. If we if we discover what we want in our life the most, I think what could motivate us could be the pain of having disease, the pain of being in that hospital, the pain of, those BAD things, the blindness, the amputation, the dialysis, and not having even a victim mentality, but a victor mentality. And
Yes.
you know, how happy would you be knowing that you have the discipline to stay on course and live your healthiest and happiest life rather than, going to the casino and just rolling the dice and saying, I hope I'll have my health. You
Yeah.
know, let 2025 be our healthiest year. And uh, one of the things that I learned in business school was what gets measured gets done. And so you could measure, of course, your weight, you could measure your blood pressure, you could measure your glucose at home. You could become your own doctor. There are
Yes.
things that you can do. And so if you could live a life of normalizing your body weight and just lowering your glucose, and remember, it's not just about sugar, it's about inflammatory foods. There are so many foods that are inflammatory. And the greatest one of the greatest secrets and the greatest learnings and the greatest transformation I had in the last 12 months was a continuous glucose meter, which was on my arm for a couple of weeks. I actually wore it for a longer period of time. And I actually learned what my body, what my genetics were telling me I should eat and what I shouldn't eat. And as I was eating that Honeycrisp apple and I was watching my glucose spike, I was thinking about all of those apple picking days I went in the fall, in apple season, and I was running from tree to tree to tree, just taking bites of apples and eating so many of those red apples. I cannot go apple picking. The
Well,
red
no, no, no.
apples.
Let me interrupt you here. While you are running and picking those apples and biting just to taste, you actually are not causing the spikes for yourself because you are moving along the way. You get this, sweet treat inside of you, and you burning the glucose that comes with this right away because you are moving. It's not just like you are
Oh,
sitting.
I wasn't moving that much. I was more moving my arm from one branch to another.
Okay. Well,
I was more sedentary, but just the thought of going apple picking and putting 10 red apples into my body in a half an hour is like frightening. And so, look, if we knew what was going on inside our
yeah.
bodies, wouldn't that be a life changing? All right. We now have the benefit of technology, a continuous glucose meter that we can actually put on our arm. And I would say also, my first cousin who had an aortic dissection, which is your aorta tears and you're starting to leak blood at work and you have no idea what's going on. He said to me a week before my surgery, he said, if you could share this with the world, he says, we need to know what's going on inside our bodies. Everybody should have an echocardiogram, right? So that's the instrument they use for pregnant mothers. Well, they're going to use that same instrument uh, to measure the 88 entries, 88 pictures and videos of the four entries to your heart. You need to know what's going on inside your body. You need to know if you're born with heart disease. It's going to be a
Yes.
small surgery to prevent a lifetime of pain, right? Had my cousin gone for an echocardiogram, he could have saved his life and retained his freedom.
Mhm.
And, I like to share this. this is very impacting from the Institute of Nutritional Endocrinology. This is a quote. Um, don't give up what you want in your life the most
Mhm.
for what you want in the moment.
Yes, absolutely. Absolutely. This is extremely powerful message, and I am glad that you brought it up because very often this is the challenge that a lot of people have. They theoretically, the most they want is a bigger goal to be able to experience, uh, I don't know, maybe a trip with the family, maybe gathering together with friends and do some activities, maybe being able to pull off this, athletic challenge or participate in a project at work that requires some extra strength, some extra hours, some extra stamina, even if it is a brain work still. But right now, I really would love this donut and I will have it. And then this donut may be the last straw that puts you into a much more complicated health situation. So this is very important. And Peter, I'm so glad we had this conversation, but unfortunately, we actually have to wrap up. I need to remind
Okay.
about few things in our for our listeners what is happening in our Facebook group, so they will be aware of it and will look for it. So one thing I wanted to say that every Tuesday in our Facebook group, we have Telenurse Tuesday event when our registered nurses are actually answering the questions, the burning questions people might have. And all you need to do, just look for this banner in the group and post your question in the comments under this post. This is it. At 7 p.m. Eastern Time, the nurse will come in and she will put her comment and she will answer there, right? On Wednesdays, every other Wednesday, not every Wednesday, but every other Wednesday, we do have our support group meetings for members of our group where we meet in person in Zoom. And very often we have registered dietitian joining us. Sometimes we have some other health experts joining us. And again, there's an opportunity to ask a question and get immediate response, or we could put together our brains and think how we can help you in one way or another. Of course, every Thursday we have our podcast, Diabetically Speaking with Smart Move 360, 4 p.m. Eastern Time. And a couple more events I wanted to share. We do have now, since this year, 2025, every month we have a crash course, Diabetes 101 for caregivers, because caregivers very often actually swimming in the dark. They don't know what is going on, what they're doing, because they are not the ones who is going to the doctor's office. They're loved ones, they're people who they are trying to help going there. They're listening to doctors. Not always they remember what doctor said. Sometimes they decide to hide some information from doctors. And as a result, caregivers who want to help, they stay uninformed. And this may actually help your team to function better. So watch for those events. We have it every month now. We already had two, and next month we'll have the next one. And of course, the one more thing that every other month we have our Diabetic Healthcare Expo, where experts like Peter, like some other doctors, nutritionists, personal trainers, life coaches, uh, they have a lot of different areas of expertise get together and we're discussing all information that is so important for people with who were recently diagnosed with type 2 or maybe already been diagnosed for a while but didn't take their time to learn more about it. So this is something that I wanted everyone to be aware of. Look for those posts from admins in the group because we are putting it out for your information. We had great conversation today with Peter, and you could see how much those two diagnoses, cardio and diabetes, are related. I don't know, related maybe not the best word for it, but how close they
Connected.
go. Connected, exactly. So a lot of times people who have heart disease, they also have pre-diabetes or diabetes. People with diabetes very often eventually get diagnosed with heart disease. So let's pay attention to it. If you find it useful for yourself, I am happy. If you think that this is also will be useful for somebody you love, please share the link. It will be a great public service from you to everybody else. And we are on YouTube, our channel called Smart Move 360. Of course, this is going to be posted in our Facebook group. I will have it on my personal LinkedIn account. So there are ways to find it, and I'm pretty sure that Peter also will share it with his public as well. So let's help each other, spread the news, spread the awareness, and be healthy and live your healthiest and happiest life. Well, thank you, Peter, and we all will see you next week. Bye-bye.
Thank you.